If you've had an MRI showing a lumbar disc herniation or a bulge, and your medical doctor told you that it's pinching a nerve and creating a sciatic symptom, and that surgery is the only way to fix that physical block, well, that's what a lot of people hear, but it's not the whole story. Over the course of the next few minutes, I'm going to show you 3 powerful things that you can do, including some home regenerative exercises to help heal that spinal disc and sciatica naturally. Hi, I'm Dr. Rob Bates. I'm a chiropractor and a certified athletic trainer. And over the course of the last 38 years, I've seen hundreds of people come in with bulging discs and sciatic symptoms. It's not unusual that they're come in and they're going to bring in their MRI report with the statement from their doctor saying that they have this physical problem that can only be fixed through surgery. So many times I'll call up the radiologist and I'll talk to them about the report. And then sometimes I ask them the question is that once you do a follow-up MRI study, do you actually see cases to where those discs actually reabsorb and heal on their own? And the answer to that is absolutely. So how does that disc heal? How does the body heal? If you're to get a cut on your arm, what's going to do the healing? Is it going to be the stitches or the antibiotic ointment? Or if you have a dead body on the ground and you cut that and you put stitches, antibiotic ointment, stem cells into it, what's actually going to do the healing? So the body has its own innate intelligence that is actually able to adapt and heal itself. In fact, that's the only thing that heals your body. And that same principle applies to the spinal disc. So when you look at spinal discs, you have them in between the spinal bones, and they're there for shock absorption and allow for proper motion of the spine. It has a tough capsule around it. It's called the annulus fibrosus, and inside this thick gel, it's called the nucleus pulposus. It has a poor direct blood supply. So since it's a poor direct blood supply, in order to get nutrients in and push waste products out, you got to have a method called imbibition, to where you have to have motion, loading and unloading of each one of those spinal joints for that to happen. So how does that disc break down and you get those spinal disc bulges? Well, through old injuries, postural imbalances are going to cause one or more of these spinal bones become misaligned and become locked up. When the spinal bone becomes actually locked up, it doesn't move properly. So now you don't get that imbibition or the proper drawing in and pushing out of the fluid. So the disc actually dries out, desiccates, starts breaking down slowly over time. Trivial things could be trivial injuries or postural imbalances can break down that to where you get a disc bulge. In fact, most people that are walking around with disc bulges have no symptoms whatsoever. Once those disc bulges get large enough, it may pinch a nerve, like the sciatic nerve, and you get those symptoms of sciatica. So most people go in and see their doctor. And the doctor typically will either use drugs or shots to help with that symptom. So when you use drugs, it could be as simple as over-the-counter type of medications like ibuprofen, Advil, Motrin, Tylenol, aspirin, or it could be repeated epidural steroid injections. All those are great for the short-term pain relief, but they are going to interfere with the body's natural ability to heal that joint. In fact, it's going to interfere with it to where it will facilitate joint destruction and degenerative disc disease. So we want to stack the cards in our favor and eliminate these things that are going to interfere with the body's capability to heal that joint. So we want to get at the underlying problem, which is going to be the abnormal stress on the spine that's locked up those spinal joints and created abnormal weight-bearing curves. Now, before I go over into these solutions that you're going to be doing at home, you got to understand that people that have disc problems and sciatic issues, everyone's going to be a little bit different. The way we apply it and how it's going to work on them is going to be different. So it's very important that you talk to your healthcare provider to make sure that it's going to be correct for you. Now, the first thing that we got to do is we got to understand that the spinal discs are mostly water. So we got to start off the days, we got to get plenty of water. You got to drink plenty of water. You got to drink 1 ounce of water for half your body weight. So if you weigh 150 pounds, that means you're going to have a minimum of 75 ounces of water per day. And what's important is that every 16 to 32 ounces of water that you take, you want to add in a pinch of sea salt into that water and stir it up in order to get the proper minerals that your disc and your body cells are going to need. So it's very important to front load, to start hydrating your body in the morning and also right before you do your exercises. Now, the first thing you want to do, the exercise, is that you want to heat up and warm up that area. So you want to do what we call wobbling. So you want to get a vestibular disc and you want to blow it up. Actually, you want to blow it up much more than this one here. So it has a smaller diameter. And you're going to take that disc and you're going to put it right into a hard chair. This is a little too soft, but you take that, put it into a hard chair. You sit on that. You want to start motion into that spine. You want to start off real small. Remember that everyone's going to be a little bit different. Some people definitely want to avoid it if you get sharp pains, but you want to start working into the pain, meaning you go with range of motions to where it's just enough to start getting motion in without creating symptoms. So you want to brace abdominal muscles. You want to slowly start rocking and rolling front and back, create a little bit of flexion extension within the available range of motion. And as you go, you're going to get larger and larger if your body allows it at that time. So you want to do about 25 repetitions. And this is going to start the process of bringing blood flow into the area, heat up the area, push out waste products, and get it warmed up, ready for the next stage. So you do 25 repetitions front and back. Then you're going to go 25 repetitions side to side, which is called the hula. And then you want to go 25 repetitions each way on the rotation. So fold your arms, cross your chest, and rotate within your available range of motion 25 times each direction. Next thing you want to do is a self-decompression. So you go to a counter, a sink, table, and you want to get on the edge of that area. You lock out your elbows. You brace your abdominals slightly, and then you bend your knees to take the weight off your body, and you let it self-decompress. You want to do this to open up this disc area, and you perform this for about 15 to 30 seconds. Next exercise is that you want to do abdominal curl-ups. So you get a small towel, you want to roll it up to about 2 inches in diameter, and you take that, put it underneath the small of your back, underneath the level of your belly button, and you want to brace your abdominals, make a fist, and just raise and tighten up this area. Reach towards your feet, and all you're going to do is lift your head a little bit so where it's just hovering a little bit off the ground. So it's just a little bit, because that's going to cause a lot of tension through this abdominal area. You're utilizing this towel to start recreating the proper lumbar curve. It's real important. This is an important step, because what you're doing is most people with these disc issues, they're going to have a loss of that curve that's pushing a lot of disc material this way. So you want to start establishing that curve gently with the towel as you do the abdominal curl-ups, because a normal lumbar curve is going to be anywhere from 35 to 40 degrees. We want to start working back into that alignment of the spine so you get proper motion in the spine, proper weight distribution on the spinal discs and joints. So you perform this abdominal curl-up, you do 30 seconds contraction. Once you finish that, pull that towel out. We're going to do a modified cobra. So with the modified cobra, optimally what you want to do is you want to push up onto your elbows and you want to sit in this position for about 30 seconds. So as you're doing this, you want to contract the glutes and brace the abdominals slightly to help support that area. Now, if this is too much to where it hurts, maybe creates a little shot down your leg. So what you want to do is start off at a lower level. You may just go up onto your chin on your hands, or maybe stack your fists together until eventually you get up into this position. Now with the abdominal curl-ups, along with the modified cobra, you want to do 3 rounds. So for example, you go ahead and after you finish your first set, you do your second set, you brace the abdominals, curl up, just let your head hover off that ground. So do 30 seconds, finish 30 seconds, go into the modified cobra, and you may find yourself, like I said, able to ease into a better range of motion and sit more comfortably as you do this more. So 3 rounds. Once you complete the 3 rounds, then you're going to self-decompress once again. Find that table or a bench, lock out the elbows, self-decompress for about 15 to 30 seconds. Once you finish that, then just go for a 5-minute walk around the house. First, going to help free up the pelvis and normalize that pelvis. Now you're going to continue these exercises every 1 or 2 hours throughout the day until those symptoms of sciatica have gone or just eased up quite a bit. But once those symptoms have eased up quite a bit, then you're ready to go on for the next stage, Don't have to do it, all those exercises every 1 to 2 hours. You just repeat those exercises about twice a day. But you go through your warm-up, which is the wobbling. So you want to brace your abdominals, flexion extension 25 times. Do the hulas, lateral flexion 25 times. Fold your elbows, cross your arms 25 times back and forth. Then you do your self-decompression for 15 to 30 seconds. Take that 2-inch towel rolled up. Perform your abdominal curl-ups for 30 seconds. Going into the modified cobra for 30 seconds. You want to do that 3 rounds. Then your self-decompression, 15 to 30 seconds. Then we're going to go into an important exercise for long-term spinal molding of the spine to get long-term correction, your extension traction. Roll up another towel to where it's 4 to 6 inches in diameter. Then you're going to take that towel, place it at the low back underneath the belly button. You're going to feel much more traction into that area, and you're just going to lie on that area and let it traction for 10 to 20 minutes. Because what we're attempting to do is that we're trying to recreate that optimal curve of 35 to 40 degrees. So it's going to take some time under tension to do that and some volume, so repeated times every day to do it. So you want to lie on that for 10 to 20 minutes at the end of those exercises. Do it twice a day. Keep it up for about 12 weeks. Because what that will do is that we're going to address the ligaments in that area, and it'll cause spinal molding or a spinal creep of the ligament to where it actually create that long-term changes of the spine. Benefits of restoring that lumbar curve will allow for optimal distribution of the weight on the spinal joints and the disc, allow for a much more efficient pull of those core spinal muscles, along with taking tension out of that spinal cord. In other words, we're really going to remove some of those spinal stress and interference and allow that disc to heal. So it's important that when you add the extension traction, as you gradually work your way up, you start off with about 2 minutes at first, gradually increase day by day until you get to that 10 to 20 minute mark twice a day. Maintain all that for about 12 weeks. Now also after that initial pain of the sciatica starts easing and starts disappearing, what I think it's important to add in other core exercises. So make sure you check out this next video, because it's going to go over the best core exercises that's safest for your spine, that's going to help strengthen, stabilize, and stiffen up the spine, allow for muscular endurance, and prevent that little micro slippage to where it's going to put abnormal stress and strain on the disc and then those nerves. So check out this next video. Also, you may know people that really need to get this information. Make sure you spread the word to these people, so hopefully they can avoid any unnecessary surgeries. So spread the word to these people, share this information. Make sure you subscribe. We really appreciate serving you. We look forward to seeing you on your next video.